Good afternoon, and welcome to the press conference on the renewed Canadian Health Transfer Agreement meeting between the Government of Canada and the Government of Prince Edward Island. My name is Morgan Martin, and I'll be your moderator this afternoon. I'd like to welcome the Honourable Dennis King, Premier of Prince Edward Island, the Honourable Dominique LeBlanc, Minister of Intergovernmental Affairs, Infrastructure and Communities, Honourable Jean-Yves Duclos, Minister of Health, and the Honourable Ernie Hudson, Prince Edward Island Minister of Health and Wellness. We will begin with the opening remarks, and then we will open the floor to some questions from the media. Premier King.
Thank you very much, Morgan. Good afternoon, bonjour, Quay. I am pleased to be joined this afternoon by Minister LeBlanc, Minister Duclos, and Minister Hudson. This afternoon, the four of us and our officials met on the Canada Health Transfer proposal that was put forward by the Prime Minister 2 weeks ago today in Ottawa. I am proud to say officially that what I said in Ottawa 2 weeks ago, that the PEI would be eager to accept this deal and get moving. This will provide $996 million over the next 10 years, almost $290 million of which is new funding, which will be used to assist in enhancing and innovating our healthcare system, to better provide access to healthcare for island patients and a more collaborative model of service delivery for those healthcare professionals who work within the system. Our healthcare priorities as a province are shared by the federal government. They are improving access to primary care, the recruitment and retention of healthcare professionals, clearing surgery backlogs, enhancing mental health and addiction services, improving the quality of care in our long-term and community care facilities, and last but certainly not least, leading innovation within the health system. We are in the process now of developing action plans for each of the focus areas, and I've instructed our health officials to immediately begin to engage in the bilateral discussions with the federal government as soon as possible. One thing is certain across the country and in Prince Edward Island, we know this, that the system needs to change and adapt not only for the patients that need the system for service, but also the healthcare professionals who provide it. We all know that change is hard. It takes time and energy. But in signing this deal, it provides our province with the financial stability needed to continue to make the necessary changes and innovations, many of which are well underway in our province. They include moving to a collaborative primary care model of delivery like we have with our medical homes and neighborhoods. And as I shared with Minister LeBlanc and Minister Duclos, we will have 14 of these medical homes confirmed by the end of March this year. Our government also recently approved 90 new positions to stabilize the existing medical homes and ensure future medical homes are adequately staffed to take patients off the registry and attach them to a clinic where they can receive care when they need it. So to fill these positions, we're taking some non-traditional paths to recruit new individuals to our system. We announced just this week the Atlantic Physician Registry, which will help us attract more physicians. And in 2 weeks' time, a multidisciplinary team will travel to Dubai to recruit internationally trained healthcare professionals. We have already set up over 60 interviews, and we're conducting some pre-screening now. Our team will be made up of officials from Health PEI, the Department of Health and Wellness, and the Public Service Commission. We will invest in the settlement services for when these professionals arrive on PEI to ensure they are supported and that they stay on PEI. And as I mentioned in our meeting, that I appreciate the collaboration from the federal government, particularly through the office of the Honourable Sean Fraser, the Minister of Immigration, who was working diligently to expedite entry to Canada for trained healthcare professionals so they can get here faster with less barriers. I want to also say that I'm thankful for the work of Minister Hudson and Minister Duclos. They have been working collaboratively almost on a daily basis to improve our healthcare system, not only here but across the country. Minister Hudson has been a strong leader and has helped steer our province through some of the most challenging times in our history. Minister Duclos is very familiar with the many innovations and changes that we have brought and want to bring to the healthcare system in PEI, and I have always appreciated his support and his kind words. And I want to say finally, a personal thanks to Minister LeBlanc for his leadership on this file. When these conversations first began, Minister LeBlanc and I were in full agreement that Islanders and Canadians wanted government leaders to work together to make the necessary investments required to improve the delivery of healthcare services. I'm grateful for Dominic's leadership and direction on this file. in particular for his understanding and his respect to the needs of smaller jurisdictions such as PEI and other Atlantic Canadian provinces, and that is reflected in the fairness of this funding model contained within this agreement that we were talking about today. To sum up, I would say that today is an important step, one that has been in the works for a while. We look forward to finalizing the agreement, beginning the bilat process as soon as possible, and to continue to make the necessary innovations and adaptations to the healthcare system in PEI. Our goal is always to serve island patients and the healthcare professionals who provide that service within the system. So with that, I will turn it over to Minister LeBlanc for some brief remarks on behalf of the federal government.
So, Premier, thank you. Thank you to you and to your health minister for hosting Jean-Yves and me on the island this evening. I've said to the Premier many times, I have a neighboring riding to Prince Edward Island. The bridge to PEI leaves from my constituency. But I think all Canadians are interested in the success of this province. It's a special place in our federation. It's captured the imagination of generations of Canadians. And your leadership, Premier, in the Federation is very important. The Prime Minister said this to you. I'll say it again this evening. In these conversations around healthcare, you and your government have been very, very constructive and very effective. Effective in keeping the focus on better outcomes for patients, and better supports for people who work in the healthcare system. We all know people, friends and family members who work very, very hard in a healthcare system that has been strained in an extraordinary way over these last number of years. And you, at the First Minister's table, Premier, kept the focus on what can we do collaboratively together to improve outcomes for patients, in your case for islanders, but that positive, constructive sentiment, I think, reverberated across the country. And it allowed premiers in larger jurisdictions, bigger provinces, to understand, and I said the same thing to Premier Higgs this morning in New Brunswick, to understand that helping smaller jurisdictions with, for example, a base amount of money in the bilateral agreements means that you'll benefit in a more significant way than if the money went only into a per capita formula, because your province can't realize the economies of scale that some of the bigger jurisdictions have. There are demographic issues, rural issues in your province. So thank you, Premier, for being so helpful and so effective, both as a partner for the Government of Canada, but in the Federation as well, with other provinces, and we look forward to collaborating with your government in the weeks and months ahead. Alors, si vous me permettez, juste un mot pour dire comment content, Monsieur le Premier ministre, que nous sommes, Jean-Yves et moi, d'être de retour sur l'île de Prince-Édouard, et comment nous apprécions la volonté de votre gouvernement de travailler avec nous, d'améliorer les résultats pour les patients, de comprendre que les plus petites juridictions comme la vôtre ou comme la mienne au Nouveau-Brunswick ont des besoins particuliers qui doivent être reconnus dans les ententes bilatérales, et c'est ça que nous cherchons à faire. Et nous apprécions énormément votre volonté de collaborer avec nous afin de très vite procéder à une entente qui améliorera les soins de santé non seulement ici sur l'île de du Prince-Édouard, mais à travers le pays. So with that, Premier, if you'll let me, maybe my colleague Jean-Yves wants to add a few words, and then what we look forward to most of all, of course, are questions from journalists. That's something that we would never want to miss. So Jean-Yves, do you want to...
Oui, bien brièvement, parce que Dominique a dit tout, ou presque tout. Je vais tout simplement rappeler aussi le leadership du ministre Hudson au cours de la COVID-19 qui a permis, avec celui évidemment de son gouvernement, de sauver des centaines de vies ici sur l'île du Prince-Édouard, puis éviter des milliers d'hospitalisations et des coûts économiques majeurs en raison du fait que nous avons pu travailler ensemble. Et cette démonstration de la collaboration durant la COVID-19 nous amène à être optimistes par rapport à ce qu'on peut faire à partir de maintenant pour réparer les dommages causés par la COVID-19 et préparer notre système de santé, appuyer nos travailleurs pour le futur et les défis futurs qui s'en viennent. So in English, let me just add quickly that Minister Hudson's leadership and partnership has been key for the people of this island during COVID-19. Because of that leadership and partnership on the part of the PEI government, we have saved hundreds of lives and have avoided thousands of hospitalizations and saved millions and more of cost, economic costs to people of the island. So it's based on this strong demonstration that partnership and leadership have a great value for people of PEI. It's based on that collaboration that we are envisaging now the path forward to repair the serious damage caused by COVID-19 to our healthcare system, in particular to our healthcare workers, as Dominic just mentioned, with the serious backlog that have been accumulated for diagnostics and surgeries, and now preparing for the future. We know the challenges that our health workers are facing towards when you look at the future of our planet, the future of this particular island, and it's therefore with great hope and some level of pleasure that we are looking forward to that collaboration.
Well, thank you very much, and thank you, Minister Duclos, for your comments. There really isn't a terrible lot more, but I can add that hasn't already been said here this afternoon. But again, I do want to take the opportunity to thank Minister Duclos for his collaboration over the last number of months to get this agreement to where it is here today. Certainly appreciate, Jean-Yves, your openness, always being available to take a call from myself, keeping me up to date on initiatives that has been, from my perspective, a great working relationship, and look forward to that continuing on. And I especially want to thank both Minister Duclos and Minister LeBlanc for their appreciation for small jurisdictions such as PEI. This funding will support the renewal of our healthcare system, as Premier King has already mentioned. And I do look forward to continue to work with our federal partners in the days, weeks, and months to come to improve access to quality health care, not only for Islanders, but certainly for all Canadians. Thank you.
We'll turn it to Morgan for questions from our friends in the media.
Perfect. We'll start with Stu Neepy, The Guardian.
Sure. I guess first question posed to both Premier King and Honorable Dominic LeBlanc. Correct me if I'm wrong, is this the first actual bilateral deal reached with a province? And if so, why is it Prince Edward Island that's arrived there first?
Well, I won't speak for Minister LeBlanc, but I think Minister LeBlanc and Minister Duclos have been crisscrossing the country. I think they've logged more air miles in the last week and a half probably than any normal person would in a lifetime. They're meeting with premiers and ministers. The process for us has been, there was a letter written to Minister Hudson. We responded to the letter, and I think we're working through the final details to come to what we would call an agreement in principle, and I suspect that other provinces are in a similar situation, but I'll leave that to you, Dominic, to take it further.
Well, thank you for the question. And as the Premier said, Prince Edward Island was certainly one of the very first jurisdictions to say that they wanted to quickly collaborate and get to an agreement with us on the bilateral portion. The Premier shared that with the Prime Minister 2 weeks ago tomorrow. Yeah, when the Premier was in Ottawa and met with the Prime Minister. So we're hoping in the next day or so to announce a few provinces that have been amongst the first to reach these agreements in principle. And I think we'd all be shocked if Prince Edward Island wasn't in that first batch.
Sure. I guess just to follow up, I mean, in terms of the shared priorities, access to primary care, reduced wait times, how do we know, like, let's assume Prince Edward Island doesn't see a reduction in wait times in 5 years. What happens then? What happens, I guess, to the increase in healthcare funding from the federal government perspective?
Well, two things on that, and maybe Minister Hudson will want to add more. First, there are the resources, and second, there is the will. In terms of the resources, now there are significant resources available now, in addition to what resources would have been available prior to the meeting 2 weeks ago with the Prime Minister. So $25 billion in bilateral dollars, an increase, a minimum increase of 5% in the CHT, a $2 billion immediate investment to try to help sort the problems that we see in emergency departments across Canada. So the resources are significant, but more importantly, there is a will. And in this particular province, there has been the will, and there continues to be a very clear will to help improve health outcomes and support workers in the process. You've heard just a moment ago Premier King and Minister Hudson explain in particular how they want to strengthen the health workforce through better recruitment, better retention of healthcare workers, retention being key, obviously, but also recruitment, because we know that the population of workers is also aging. So, looking internationally, how do we align the efforts of the immigration officials in the federal government with the efforts of the health officials here in this province to make sure that not only do we bring people quicker and easier into the province, but then we have these workers work more quickly and more efficiently as health workers, and therefore supportive of the health of the people of this island. So the resources are there, the will is there. We are confident, I'm very confident, that we'll achieve significant results over the next few years.
Yeah. Do you need more? Or, yeah. I would just only add that, I know there's been a lot of conversation at the national level about, what the federal government wants to achieve from this. But from my perspective, from the very beginning, I felt this was always just about collaboration. It was about trying to work together. Never once, as the Prime Minister said to me, or Dominic or Jean-Yves said to me, we don't like what's going on in PEI. What they're saying is, we're going to put significant money on the table to help you move along and go a little bit faster. And we just want to make sure there's some measurements there so we can get where we want to go. I think the Prime Minister used the term, if you don't measure it, you'll never know where it's at, or some way, shape, or form. And that's the way we've always looked at this, is that this has never been the federal government wanting to come here and run healthcare. That's never been anything like that. It's more just about, we want to make these investments. Islanders deserve access to care as close to home as possible, and that's what they've been working to do. So I have never really taken any kind of offense in any way, shape, or form to the federal government wanting to measure where they put taxpayers' dollars. Every reasonable and responsible government is accountable to the taxpayers of PEI. It's their money that we're investing and that we're spending to make lives better. And I've said a million times, and I'll say it one more time, we don't give money to any NGO or any other service group or anyone in PEI without wanting to know what they're going to achieve with it and how they're going to spend it. And it's never been a problem for PEI to offer the same back to the federal government.
Sheehan Desjardins, CBC.
Hi, everyone. So my first question, I'm just wondering, you listed things like improving access, clearing surgery backlogs, improving quality of care. So just PEI specific, how will this money be divided, and why did you pick those areas as areas of concern that need to be addressed?
Well, I mean, they're the areas that we need the immediate focus on. I mean, everybody wants to have access to care, as I say, as close to home as possible. So we're on a pathway, and this is what we, Minister Hudson and I, shared with our federal counterparts today, is just we gave them a quick synopsis of what we have been doing in PEI and what our roadmap is, and our priorities align very much with what the federal government wants. And as Minister Duclos told us quite openly, the priorities the federal government has set have come from the ministers of individual jurisdictions across the country. These aren't ones that they made up on their own thinking they should, put pressure here or there for. The priorities are coming from the grassroots all the way up through. So in terms of improving access for Islanders, we started with our PEI Pharmacy Plus program, which is almost 17,000 Islanders getting access for 32 common ailments that they weren't able to get before. That's an innovation that we put in the system. The Maple app has been something that 15,000 Islanders have accessed. We're accessing care a little bit different way. Those are the innovations and improvements that we're trying to make and adaptations to the system. But we also need to make the system better for the people who don't just access it, but for the people who work within it. We have the very best healthcare workers in the world working here in PEI. They're having a difficult time. They've been through a really difficult time, in particular with COVID and all of the challenges that they've had to face in the last couple of years. And we need to listen to them and listen to how they want the system to work so they can work within it. And that involves a collaborative style. That's the collaborative model that they want to work in. So those are just some of the priorities that we're working on. And as I say, the federal government was very open and it matched their priorities. And I think that's why we'll be among the first to sign on to get rolling and to continue the path we're on.
And then a follow-up question just about the recruitment trip to Dubai. How's that going to work? Why do you expect it to be successful? And will there be more like this in the future?
Yeah, I mean, and I'll let Ernie can follow up here, but you know, our recruitment team has been working across Canada and across the world trying to find healthcare professionals in a very competitive world. We've identified Dubai as a place where the healthcare professionals are expertly trained. They have really good, training. They want to come here and work. We've done a little bit of groundwork leading up to it. So as I say, we have over 60 people that we're interviewing. It is our great hope that at the minimum we would offer 30 jobs, hopefully more for them to come here. But it's really just trying to find innovative and new ways to attract people to come to the system. And really the other part that we have talked about is the federal government is really trying to work hard with us to expedite their entry into Canada. And we're working with the College and nurses and all of the other professional organizations to make sure that if we're able to successfully get people to come from Dubai into Canada, that we can get them to work in their profession at the level they can be as fast as possible, because I don't just want them to come to PEI, I want them to stay in PEI, to live, work, and raise a family in PEI. So,
Premier, if I can, just to add to what the Premier said, we talked about this in the meeting a few moments ago. The Government of Canada absolutely accepts the responsibility of working with provincial governments, in this case Prince Edward Island, as the Premier and his officials identify these healthcare professionals, want to bring them to Canada, are able to certify their credentials so, as the Premier said, they can work to the full extent of their skill and experience when they get to PEI. Our job, and we've actually changed the legal authorities for the immigration minister to be able to deliberately select those people to help us expedite them coming to live in this great province as quickly as possible, because the need is great, and other provinces have talked to us about this. So if we can use the federal immigration authorities to support what the provinces are doing in an expedited way, that's certainly been the decision that our government has taken, and our colleague Sean Fraser has new legal authorities which would allow him to collaborate with provinces exactly as the Premier said, and hopefully these healthcare workers can be in Prince Edward Island very quickly.
And Sheehan, just to follow up, I mean, that's why we're worked on the Atlantic Physician Registry, so we can have a greater movement. That's why we invested in the medical school and the Faculty of Medicine at UPEI, which also includes the doubling of nursing seats in their RN program. So we're trying to do everything we possibly can to recruit, but also to retain those within the system. So it's a competitive field. And we're swimming in a big pool, but we think there's many attributes in PEI that people will really like. It's a great place to live, work, and raise a family. It's a safe place, and I think we will sell that, and I think we will have some success, and I think Dubai will just be the start. So,
We will now go to the phone line to answer some questions from the media that are attending virtually. Stephanie Seco, CTV.
Hi there. Premier King, how satisfied are you with this agreement?
Oh, I'm very satisfied. As I said in my opening comments, this is close to $1 billion over 10 years in healthcare money, and almost $300 million of which is new money for us. That's game-changing money for PEI. But I've also been the Premier who has said time and again that what ails our healthcare system isn't just about money. It's about trying to find those innovations and adaptations along the way. But to do that, we're going to need to make significant investments in the shared priority areas that we've outlined. So I'm very happy. I've always been confident that in learning that there would be a base amount of funding in this and that there would be a recognition for small jurisdictions. I thought that this is something that islanders would want their premier to accept and to get to work and put the money into play as quickly as possible, and I think that's what we're trying to do here today.
And just in terms of the Dubai recruitment, are there other areas that the province is looking at to recruit professionals from?
Yeah, we've talked. I chaired the Council of Atlantic Premiers meeting this week, at the first of the week with my Atlantic colleagues. I know there's others in our jurisdiction who have been doing some similar missions to India, to Philippines. We're working with them to see if we can have a more collaborative regional approach to jurisdictions such as that, and that will continue. I mean, when I was in Ireland last spring, I visited some of the med students from Canada who are learning and training at Trinity College, and they all would love to come back here to Canada. So, you know, we need to just work on ways to make the systems a little bit more nimble, and to get these individuals back into the country when it comes to our physicians, as an example. But yeah, I think like the world has gotten so small now. I think we can travel to places far and wide, and I think that when people understand what we're doing here, how innovative we are in PEI and what we're able to offer, I think you'll see more and more of these missions, but Dubai should be a good start for us.
Lisa Mayer, CBC. Lisa Mayer, CBC.
That was the easiest question.
Sometimes they're on mute.
That was a good question. That might have been the best question so far.
That is all the time we have for questions.
Lisa, are you there?
There we go.
Are you there, Lisa?
Oh, sorry about
Okay,
that. Yes,
okay.
I'm here. Hi,
Okay,
thank you. Good afternoon. Thanks for taking our questions. Just a question, with the announcement of the new Atlantic Physician Registry, do you have any plans in place to stop island doctors from leaving to practice other places or to split their time to ensure that there isn't more strain on doctors here?
No, as I said, and Dr. Fury, who's the Premier from Newfoundland, answered eloquently at our news conference on Monday, is that doctors have the ability to move now. What we're doing with the Atlantic Registry is to just make it a seamless transition back and forth. As one of the smaller jurisdictions, Prince Edward Island tends to do a little bit better than the others, for example, in terms of that transient nature within the region. A lot of our physicians who end up being locums, who come in for a short time to practice here, whether it's in the summer, in the winter, whatever it may be. 50% or 52% of the doctors we've been able to recruit over the last 2 years have first been locums. So we see the Atlantic Physician Registry as a net positive for Prince Edward Island, and I think you'll see. I was very encouraged to hear today that those in our nursing sector also would like to see some similar programs developed so that we can make it a little bit easier for our health professionals to move within our borders. It never made sense to me that if you're a doctor in Saskatoon, that you couldn't be a doctor in Charlottetown without any challenge. And I think that will be the next step when we move to from the Atlantic Physician Registry, is to go Canadian-wide and to break down some of these, I think, Dominic, unnecessary barriers would be the best. Yeah.
And the Premier said it well. I'm not sure I share the view that Prince Edward Island would be a net loser, as you said, Dennis, in that calculation. I know doctors from my province in New Brunswick that have recently left to come and work here in Charlottetown. So that speaks to the competitive nature of these jobs, but it also, I think, speaks to the desire that we've seen, and we think it's terrific, Premier, that the Atlantic provinces want to sort of use this as an example for the rest of the country of encouraging this mobility. The challenge for all of us is to raise the total number of healthcare professionals in the system, but how we can better share them is part of that discussion. And the steps the Atlantic premiers took under your leadership here, the meeting was here, Dennis, you chaired that meeting, we think is a terrific example of what we hope can happen, as you say, in a broader perspective across the country.
Thank you. I just have one quick follow-up. Premier, you mentioned barriers at the beginning, and Minister LeBlanc, you talked about changing some of the immigration policy in terms of doctors coming over. One thing we've been hearing about is the red tape and bureaucracy around hiring and licensing of physicians on Prince Edward Island. Is that something you're considering changing as well to bring more physicians?
Look, we've had a great relationship with the College of Physicians and Surgeons. When it comes to recognition of credentials, for example, Dr. George Carruthers has been, with his Atlantic colleagues, among the leaders within this. I don't think if there ever was a time when doctors were protective of this, of their turf, I think that is long past. And I think doctors now, and the college recognizes that, you know, their job is to make sure that we have trained doctors here who are come from recognized institutions who can do a good job and maintain safety and provide the services to islanders, but they don't want to be an impediment along the way. So they're working all the time to streamline some processes when they can, to work together when they can. And I think I've always felt, certainly in my time since I've been elected as Premier in PEI, that the college has always been helpful, has always been open to making it a little bit easier. I think that's evident within the Atlantic Physician Registry that we announced this week, and I suspect there's an interest to go further. But yeah, I mean, we'll have to work in collaboration with the College of Physicians. This isn't something that government can come in with a hammer and just say we're going to recognize every credential. There's a process here. I respect that very much, but I feel I have a willing partnership with the college.
That is all the time we have for questions today. Thank you very much.
Thank you. Thanks very much, Ernie. Well